There's sort of two separate questions in terms of explaining comparative effectiveness research to patients and then actually engaging them or involving them in the process. With respect to explaining it, it really is to contextualize it. So you have to look at individual patients and what research they might need, and then identify again the problem we're trying to solve, how the research actually solves it, and how it ultimately is going to improve their decision making and help them to really get the treatment that actually works for them. In terms of engaging them in the research process, you really have to identify the points of engagement. Everybody is saying that we should just engage patients. Well, that's nice, but it's not meaningful. You've got to identify the very specific points of engagement, what the role of that engagement is, what are you expecting from that engagement, and define it for a patient so they understand what it is they're contributing. And then patients can self-identify as to what point in the engagement process they actually want to participate in. Because patients aren't going to want to be involved in every single point of engagement. There might be 2 or 3 that interest them. But if you don't define it, explain it, and then offer the opportunity, they're simply not going to engage. We often assume that if you just dump information on patients, they're going to be able to digest it and make meaningful use out of it. Simply not the case. There's a great quote by Stephen Covey that says, effective or mature communication is a balance between courage and compassion. The courage to be truthful and forthright in your communication, but the compassion to understand the impact on the listener. What you have to do is take the information and tailor it to the individual that's going to be receiving it so that they can actually understand it and make meaningful use. That really focuses on the communication and dissemination of this. We have to do what we know best, and that is to bring this information together and to make it meaningful and then to distribute it in a way that people can actually make use of it. We can't simply just dump data on patients and think that's going to be helpful.